Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer in Douglas County, with another of our Facebook Live events here. This is your chance to get your questions answered. So if you have questions, send them to us at facebookquestions@douglaspublichealthnetwork.org, or you can put them in the chat section, and then Kristen and Vanessa will go ahead and send them to me, and we'll go ahead and do them today. I'm a little out of breath. I was running because there's a lot going on. So as we typically do, we start at the world view and then move down. The very excellent news is that at the world view and at the national view, this pandemic appears to be really quieting. So the number of cases that we've had now really fell. You know, with the US, we used to have about 300,000 cases a day, and the number of cases, hospitalizations, and deaths is clearly falling, and that really is a good news. However, when you look around the country, there's still some hot spots. We see New York, we see South Carolina, we see Texas, we see parts of Colorado, oddly enough, and California being kind of hot spots along the way. In Oregon, the disease is generally down, although it's not down as much because it wasn't as up as much before. So what you're seeing now, rather than the whole country getting really low, the country is stuck at about 20 cases per 100,000 per day, which is about where we are in Douglas County, and sort of stuck at that level, which is still pretty high, but clearly much less than it was before. In Douglas County, this has been our worst week. So you remember we had our first early peak, we had our second peak in the summer, our third peak between Thanksgiving and a little after Christmas, and now we're seeing a fourth peak. And that fourth peak is worrisome because it's a high peak. It's associated with hospitalizations and occasional deaths. So really it is still a bit of a worry. And when we look in Douglas County where it's coming from, it is coming from a bunch of places. So there's no one part of the county that if you remove, the rest of the county would be fine. There's no one sector that if you remove, the rest of the county would be fine. The biggest sector is clearly in our nursing homes. We've had 5 separate nursing homes with a small number of cases. One in particular that's had a big outbreak that I saw in the newspaper today, over 50 cases, 3 hospitalizations and a death. So really a very significant outbreak in that nursing home. We think the nursing home has done a good job with infection control, but it just shows how quickly this spreads. The other thing we've seen that from that nursing home is the vaccine seems to be very effective in preventing hospitalization, 100%, very effective at preventing symptomatic disease, and overall very effective in preventing infection. And I know we have some questions about that nursing home, so we'll get to it. Second thing we're seeing is a lot of cases in schools. This doesn't mean that there's been spread in schools. In fact, there's only maybe 1 or 2 places where there's even a chance of spread in schools. But what we're seeing is before and after school activities and activities associated with school where we think this is spreading. So, you know, kids get to school and they plan parties for the weekend. They plan sleepovers. They have birthday parties. Birthday parties seem to be the worst. And then athletes on the field are using protection and distancing and whatever, but then afterwards they go to each other's house and play video games or go out to eat. And this is where we think we are beginning to see the spread associated with schools. Now again, the kids don't seem to be very sick with this, although there are an awful lot of kids out. And when kids are out, then their classes get quarantined. And so that you have this on again, off again thing, which is really complicated for people who are at school. The other place that we've seen is workplace outbreaks. And again, these workplace outbreaks appear to be happening not necessarily during the middle of the day when people are working, but during breaks, during other kinds of things where people get together. And in many workplaces, workers like each other and they go out after work, maybe for a drink or go to a party or something together. And that's where we've seen the spread. So we've seen quite a bit of spread in Douglas County. And this has been, as I said, our worst week. All right, let me get to your questions here. And we'll see what we got. All right, so if you have questions, put them in the chat section and we'll get to them. These are questions that came to us on our Facebook questions at douglaspublichealthnetwork.org. So the updated vaccinators list on the website, we're going to be updating that on Tuesday when we have a meeting with our vaccinators. There are a couple of new that are trying to get on the list. The problem is that vaccine has been a mess this week, as we'll get to later. And I'll explain to why it's been a mess. So Debbie says, I have rheumatoid arthritis and take methotrexate and Enbrel. Yeah, so the question is, what do you do about that? And again, there's a lot of interest in this because what these medications do, methotrexate, Enbrel, these other kind of things, they decrease your body's immune response to this autoimmune condition. And so your ability to respond to things is decreased. Now, that would make you worry because it would make you worry that your body would have a decreased reaction to the virus if they got it, or it may have a decreased reaction to the vaccine. From everything I've read is that people on these immune modulating drugs should still get the vaccine because the people who have these conditions and take these drugs are at great risk and should get them. But again, like all this stuff, I talk with your doctor and see what they say. But generally the recommendation in people who've got arthritis and other kind of diseases that they should certainly get the vaccine. Next is a long question. It says, I see there's a rumor that one of the outbreaks that happened at the assisted living facilities all came back positive, and now a few more testing that came out negative, but there's still being active cases. How did that work? Okay, so like with any disease, say strep throat, there's a time you don't have strep throat, there's a time you do have strep throat, and then there's a time that you don't have strep throat, and your test is negative. So that test go negative to positive to negative is not only some big surprise, it's exactly as expected. Now, in terms of how long you are contagious, that's much more complicated. And generally for people in nursing homes, they're either 10 or 20 days in isolation. So it certainly is possible that you had a negative test at some point in the future. Almost everybody in the nursing home did, had a positive test at the beginning of this and still have a negative test, but it's still considered to be the possibility that you could still be contagious for a while. So that clearly is very typical and doesn't really make anything else. She said, I told the person who was telling me this that if some of the people who were vaccinated did not get sick and have the virus, then how would those tests happen like that? So the story is that we do know that in this nursing home there were some staff and patients who were fully vaccinated. There were some staff and patients who'd gotten one dose of vaccine, partially vaccinated, and then some staff and patients who had no vaccine. And so it's a complicated thing, but the people who got hospitalized and died, none had gotten the vaccine. For the people who got seriously ill, none had had the vaccine. There are some people who got the vaccine who had a positive test, but didn't have symptoms. They were asymptomatic. And so it's really clear. So, people saying this is fabricated, we could go through the data with you in incredible detail. We have a bunch of professional epidemiologists working here and we're going through it. This is absolutely, truly not made up outbreak. This is a real outbreak, and we worry about nursing homes because they have a high rate of hospitalization and a high rate of death associated with outbreaks in nursing homes. So my plea is that if you work in a healthcare setting, please think about getting the vaccine. So Corey says, since we've opened up schools, how are we in comparison to doppelganger counties? Almost exactly the same now. So back in the time when we were lower, much lower than from much of the pandemic, and we're still lower than the total number of deaths, but the number of cases per week, now we're about the same as the doppelganger counties. So as we open up bars and we open up restaurants, we open up gyms, and we open up schools, not shocking that our rate of disease would come up to about where it is in the other counties. And so it's not, our high rate of disease is distressing to us, but in these other counties, it would be, well, we've been doing this since September. So that's it. So lots of people asking about the vaccines. So I have the answers for you. And so I must have spent 20 hours this week with people at all levels of state government trying to figure out the issues. So when you look at the OHA website about number of vaccines given in Douglas County, I just checked it before, it was 9,646 in Douglas County for a rate of about 800. And so per 100,000. There are a couple of counties that are lower than us, a couple of counties that are higher than us. And there are 4 reasons that our numbers are relatively low. So the first reason is that early on, large health systems got lots of the vaccine so they could give a lot of vaccine quickly. And those were St. Charles, Asante, Peace Health, Salem Health, Kaiser, and OHSU, and Providence. So when you look at those places, those are all important places. And what you'll notice that they're not in Douglas County. So that Douglas County didn't get these big health system boluses. So for example, in one weekend, St. Charles in Deschutes got 17,000 doses because they had a big event planned. Douglas County, because we did not have a big health system like that, got 1,000 doses. They got 17,000 doses. And so not surprising that they jumped ahead because they had these big events. Well, the state has since recognized that that really was very inequitable in the state, and they're working on fixing that. And I think there's a new formula out that's going to actually be distributing doses on a per capita basis, and Douglas County is likely to catch up. The other issue is that the VA got a lot of doses. The VA has vaccinated about 3,000 people, and that's great. However, because they're a federal thing, they do not submit the data to the state. They submit the data to the CDC, and it doesn't get counted in the Douglas County numbers. So the 2,400 veterans and the 800 staff that live in Douglas County that got vaccinated doesn't show up in the Douglas County numbers. If you put those numbers in there, then Douglas County is pretty much right at the state average. The third thing that happened was, and we found this error this week, is that the state attributed some vaccines to the corporate office of a vaccinator rather than the store and the place where it was given. So there were a couple of places in town, like one of the pharmacies, whose corporate office is not in Douglas County, and so they attributed the vaccines to the county where the corporate office was rather than to our county. That makes up another several hundred. And then there was a computer issue with catching some of the doses from some of the larger clinics, and I think we've gotten that. So put all that together, it looks like going in the future, our vaccine allocation is going to be great. It's going to go from about, at most we were getting like 1,200 or 1,300 new doses. We're now going to get 2,500 new doses a week, and then second doses for those first doses 4 weeks later. So I think that's great. So I think the supply is going to go up. I think the state is recognizing that those large events have perturbations, and what they're doing then is, for example, if there's a large event in Lane County, they're decreasing the amount that goes to other providers in Lane County so that the overall amount in Lane County would be the same, and the same in Jackson and Josephine and whatever. So I think that is I think that's great. So I think in the future what you'll see is that we'll be catching up with the rest of the state in those numbers. And if we ever include the VA numbers, which we've asked them to do, I think you'll see that it's going to be great. So Bruce says, what do I think about the Israeli study on vaccinated folks not transmitting COVID virus as much? Bruce says that's a study. So Israel, a relatively small country. So when you hear about Israel, Israel's about the size of Douglas County. So it's a relatively small geographic area that's got a lot of relatively large number of people in it. They've got a fairly advanced healthcare system. So they made a deal with BioNTech, the maker of the Pfizer vaccine, that BioNTech would get them a lot of vaccine, and they then would provide a lot of data. And what they saw on this study was that people who are vaccinated are very much less likely to get severe disease, more than 95% less likely, about 90 or 95% less likely to get a symptomatic infection, which is how the studies were done, and about 80% less likely to get a asymptomatic infection and pass it on to others. And that's what we're seeing on each of the vaccines. Really effective against preventing severe disease and death, very good at preventing symptomatic infections, and good but not nearly as good in preventing asymptomatic infections. And I think when the data from our nursing home is done, we're going to show exactly that. So Sarah says, I'm due for my second Moderna vaccine tomorrow, but I have a scratchy throat and a little head cold, but otherwise feel fine. Can I still get my vaccine tomorrow? Well, there's no contraindication for you getting a vaccine, but you shouldn't leave the house. If you're sick, you should stay home. You can get that second Moderna dose anytime in the next 21 days. So if you're sick, stay home. And so I know you say just a little head cold, but the little head cold could be just a little head cold, or it could be COVID, and I don't want you spreading it to other people. So yes, you could technically get the vaccine, but please stay home and get the second dose some other time. So as we try to build more confidence in the vaccine, I appreciate your analysis of the recent care center infection. Right, so I think that's been great. So the question is about school outbreaks. Have we seen any cases among teachers who've been vaccinated? No. We've only seen about 20 or so cases. The teachers are not yet through their second vaccine. But every time we find a case, we check their vaccine status. And if the vaccine status is positive, then we'll go ahead and look at that. So yes, right now we don't know about that. But I think in the next few months, we'll get a good chance to see just how effective this vaccine is in doing that. So Pat says, where do seniors from Sutherland go to get the vaccine? So for everyone in the county, you should go to your primary care doctor. Most of the primary care doctors in town are providing vaccines, so I would check with your primary care doctor. If your primary care doctor is not providing vaccine, then the Bimod in Sutherland is providing vaccine, and we would have you do that. Tim says, where do we go to get our second shot? So in general, second shots are paired to the first. So if you've got your first dose up at the Salem event, the Salem drive-through, the second dose is going to go to that Salem drive-through. And so your second dose will be waiting for you there. And so you should be getting your second dose there. Now, sometimes this doesn't work. Somebody was in jail somewhere and got a first dose and then need to get a second dose, or they got their first dose in Hawaii. Those are going to be complicated. But in almost every case, you should go for your second shot where you got your first. So Veronica says, when does the time start for the 2 weeks for a change from high risk to extreme? So all of the risk levels in the state are calculated on a 2-week basis. Those 2 weeks end tomorrow night at 11:59, and then they are published internally on Monday, externally on Tuesday, and then if there are changes to the risk level, that happens on Friday. This is totally a state function. We obviously investigate the cases, but all of the case numbers are in the state database. The state makes the calculations, and the state makes the changes. So the county, other than understanding this, we have nothing else to do about this. It does look like we likely will go from the high risk to the extreme range. And that's disappointing because that means then that indoor dining and such may be curtailed. So it's disappointing, but not shocking. You'll remember that Douglas County has been the only county on the I-5 corridor that has been open. And because we have been open and schools have been open, so almost all of the schools that have been open in Oregon have been in Douglas County, so it does indeed lead to more mixing, and the more mixing leads to more spread of the disease. But we can get back. It won't take 2 weeks. We can get back to the high range and open up again, but we really need to work hard in the next 2 weeks to get these cases down. So Sherry says, could I discuss the best remedy if you get COVID and are at risk? So again, COVID is a very variable disease. There are a lot of people who will get COVID who will be totally asymptomatic. There are some people who have just mild symptoms, in which case you don't need to do anything. There'll be some people who have more severe disease, and then some people who have critical disease. And what you would treat on all of that is really quite different in that. So this week, new data that comes out about things that work and don't work. So convalescent serum, which at one time we thought would be great. That is, you take serum from somebody who's had the disease, infuse it in somebody who has had the disease, and then you infuse that serum into somebody who currently has the disease in the hope that it would work. And convalescent serum works in many diseases. A disappointing study that came out this week that showed it really did not help very much. The second is high-dose vitamin D. We do know that people with low vitamin D levels seem to get the disease more. Some people said, well, if they get this, then let's give them some vitamin D. Did not seem to work. And the other one was Pepsid, this antacid that early on was thought, oh, maybe this will make a big difference. And apparently it does not work. But what does work? So we know that Decadron and inhaled corticosteroids do work. We know that remdesivir does decrease your length of stay. We know that things that they do for you in the ICU, such as giving blood thinners and using high flow oxygen, prone positioning, which means being on your belly, all seem to really help. There's still things we don't know about, like ivermectin has been a big thing. Still not exactly clear if ivermectin works. Hydroxychloroquine probably doesn't work. There's one called Actemra, which is a rheumatoid treatment that may work a little bit. So the home runs are the Decadron, remdesivir, and Actemra, a little bit of a help. Certainly prone positioning, a big help. High flow oxygen, a big help. Anticoagulants, a big help. Everything else, not so much. Now the other one is the monoclonal and the polyclonal antibodies. So these are antibody cocktails that when people are first diagnosed that you get intravenously, and they may help a little bit. They are not very widely available, but they also help, we think, a little bit. Luvox is another one, which is a drug which we usually treat obsessive compulsive disease. There's some early data, but not enough, I think, to prove that it works. So Casey says, is there a concern that the COVID variants that are more communicable will be more readily passed on surfaces? We do not think so. So it makes a tiny change in the surface protein, but it doesn't change the whole way that these viruses work. So we do not think that is going to change their communicability. FDA came out this week, said do not need to worry about food or food packaging. They have no cases where they think that this has transmitted disease. So I think we can worry a little less about food and food packaging, but I think we still need to worry about droplets and aerosols. So Donna says, how safe is the Moderna shot? So the Moderna shot has been out for a couple of months now. Tens of millions of people have gotten it. And this is what we know. We know that in general it's an incredibly safe vaccine. We do know that a good number of people after the first dose and a higher number after the second dose will have local reactions with redness and soreness in the arm, sometimes headaches, sometimes fatigue, sometimes a little bit of low-grade fever, but that just means that it's working. In terms of other safety signals, really haven't seen very much, which is great. There were some cases of an anaphylactic-like reaction that people had, but those seem to be about 1 in 100,000, so they happen, but not particularly common, and we've not seen any other long-term consequence. So in terms of comparison to other shots, it is a very safe shot. Now there are some deaths associated with the vaccine, but when you have 13 million people who've gotten the vaccine, there are 113 deaths associated with the vaccine. Well, if you take when you take 13 million seniors, you are going to have some deaths. They've all been looked at, and none have been attributed to the vaccine. Now, what you're going to need to do is you say, well, if you took 13.7 million people of that age, how many deaths would you expect? And they're doing that analysis now to be sure that there are no more deaths than expected. So Nancy said, I had both doses without any reaction. Is this unusual? Do I have less immunity? Well, it would be unusual for you to have no reactions at all, no redness or soreness in the arm. Certainly, if you have a moderate reaction, it usually suggests you're building immunity, but it is not perfect. Do you have less immunity? You may, and so you might want to get an antibody test to see if you have an antibody level. But young, healthy people tend to have less reaction anyway, and so that you didn't have any reaction could just be that you didn't have any obvious reaction, or that you're really tough, or it could mean you have less immunity, so an antibody test might be able to help you. So Eric says, I work with seniors and people with disabilities in their homes and have been told I can't get the vaccine yet. So it's a very, very, very complicated sequencing plan that the state has put together about who's eligible and who's not eligible. And so it's really, truly a multi-level part question about whether people are eligible or not. And Eric, I would have you send an email to the vaccines at douglaspublichealthnetwork.org, and we'll take a look at it and see. Now, if you work with seniors in their homes, helping them with their taxes, say, or helping them with someone else, you're not eligible. If you are working with their homes providing healthcare services, then you might be eligible. And so it parses really, really carefully on what you're doing, right? So a plumber could be coming into my house to be working on this, and he probably goes into people's houses, some of where he's providing plumbing services. So plumbers that go into that places where people are disabled are not covered. However, if the plumber is employed by a nursing home, they are covered. And so it's a very complicated differential about who's covered and who's not. So Eric, if you can give me your specific situation. So if you're a healthcare worker that works doing healthcare with people with disabilities in their homes, yes. If you're not a healthcare worker, I don't think so. But again, it's all very dependent upon many facts along the way. And people get frustrated by that, and nobody more frustrated than me because it's so fact dependent. So Nita says, are vaccine companies working on a vaccine for kids yet? So I don't think they're working on a different vaccine. I think what they're doing is they're working on a vaccine and moving down the age ranges. So typically when things get approved, they get approved in adults because adults will volunteer for studies, and they'll do that. Parents are a little reluctant to volunteer their kids for studies. And in fact, they've had trouble signing up enough kids in the studies to know if they work. I understand we may hear about some data in teenagers within the next couple of months, but kids younger than that, say 5 to 12, it'll be a lot longer. So again, it's a little hard for parents to say, oh, sure, go ahead and give this experimental vaccine to my 6-year-old. And because of that, these are a little harder to know. But if we're trying to get to a point where we have enough people immune, kids are going to have to get vaccinated. And so there was a long story today about doing that, but it's going to be slow. I think Dr. Fauci said today he did not see kids less than 12 getting vaccinated until 2022, which seems way too far off. Yeah, so Midge says, is there a website that we can see which pharmacies have the vaccine and are giving it out so we can sign up on? Yeah, it's on our website, but it's confusing because there are 3 different pharmacy programs. So there's a federal pharmacy partnership 2 that we have nothing to do with, but the feds are giving vaccines to both Albertsons here to the Albertsons here in town, and then to Costco. Then we, using vaccine that comes from the feds to the state to us, we're working with the 3 by Mars, Fred Meyer's, and Gordon's drug, and we're working with other groups. Yeah, so Allie says, since all counties are not reporting VA doses, why would every county have the same problem? Well, our county has far and away the greatest group of seniors getting services at the VA. So there's a big VA in Portland and they're giving it, but it makes up only a tiny fraction of the seniors in Portland. There's a VA clinic in Eugene, but again, it's only a tiny fraction of the people here. It is not a tiny fraction in Douglas County, right? So remember, we have 2,000 doses here, for our county of 100,000 people, it is far and away the biggest number. So it's going to perturb everybody's numbers. But for example, in counties where there is no obvious VA presence, it's going to affect their numbers much less than it affects ours. So Mitch says, do you know if White Oak Clinic will have the vaccine? I've talked with the people at White Oak. I'm asking them to sign up. They're already signed up to do some vaccines, and they're considering doing the COVID vaccine, and so it would be great. Deborah says, do we need any volunteer help? I think right now we're good, although I think in the next coming months, we may well need some help if, for example, there is a lot of vaccine that comes out, and the J&J vaccine, which we'll talk about later, there may be a large amount of J&J vaccine that comes out in March or April, in which case we are going to need a volunteer event to go ahead and get all that vaccine delivered. So Christine says, will the schools close again if we go into extremes? So the decision on schools is based on, is the school board's decision. Public health has only an advisory role. We're not seeing a lot of spread actually at school itself. So again, I don't know if we've had any cases where student A gives it to teacher B in the class, or student A gives it to student B in the class. However, there are times when there's 2 or 3 cases in school, either they seem to have been introduced simultaneously and not from each other, or their connection has something outside of school. So for example, when we see 3 kids on the sports team, it could be that these kids got it because they got it during sports, but when we do the interviews, it's far more likely that they got it in the drive to the sports practice rather than at the sports practice itself. And so for any of us who played sports in high school, you know that, going out to eat after you play, going to a friend's house after the practice, driving together in the car to McDonald's to get some food, those are all the things, and that's how we think this is spreading. So Veronica says, why should you distance from your animals if you have COVID? So what we do know about this virus is that it spreads very efficiently in humans. It also spreads very efficiently in ferrets, mink, weasels, and ermine. So it spreads in those ferret-like animals. So we clearly know it spreads in those areas, and we think that outbreaks in mink farms have really been a huge problem in the world. It spreads from humans to dogs, but not very efficiently, and dogs don't get very sick, and dogs seem to be the dead end, so they don't spread it to other dogs. But still, you don't want to make your dog sick, so you should stay away from them. Cats are kind of in between. Not as contagious as ferrets, but more contagious than dogs. So there have been a number of stories where it's in a zoo and the cats get it, but not the dogs or other animals. So why this is weird, why ferrets are like humans, we don't really know, but that's why you should stay away from your animals if you actually have COVID. So Randy says, among the cases this week, are any of them from the variants? And the answer, we do not know. So what we do is when we have an outbreak like the nursing home, or when we have an unusual case, or a case where there's unusual spread, we send it for genomic analysis. But genomic analysis in this country is very, very, very slow. We have one that we sent out 3 weeks ago that we still haven't heard. So we do not know if there are any variants here in Douglas County. That would be a worry, because the variants do occur. And when the variants do occur, we do think they're more transmissible. We do think they are less likely to be affected by the vaccines. Although the vaccines are still very effective in the places where they're variants, they seem to be less effective than with the original virus, which again, not surprising. And so we don't know if there are any variants here, but we're carefully looking and sending out. So Annabelle says, have we had any vaccine go to waste since it's so confusing to sign up for the vaccine? We believe we've had 1 dose that was drawn up incorrectly and went to waste, but other than that, of the almost 10,000 doses, we don't think we've had any waste. These 2 vaccines are really complicated. They have to be, once the vaccine is punctured, they have to be used right away, and they have to be used in a very special way, so it's easy to see how vaccine could get wasted. You may have seen that story on the news, is that they were coming back from somewhere down in Josephine County, and they got caught in a snowstorm, and they had to give the vaccine right away because otherwise it would go to waste. And so there is stuff like that happens. But in Douglas County, we really have not wasted, except for that 1 dose, any vaccine, which is pretty darn great. I just talked with one of the clinics that did it today. Not a single dose wasted. 120 doses went in. It was just like clockwork. So things are getting great. Okay, well, a couple of other things. One is the J&J vaccine. So the J&J vaccine is going to be great. So the J&J vaccine is an adenovirus that cannot replicate, but can infect your cells. and it has some of the DNA from the virus in it. It gets in, your body then makes the spike protein, your body then makes an antibody to the spike protein, and it works very well. So the J&J vaccine seems to be, it's a single dose, which is great. It doesn't need the super cold storage requirements, which is great, and it doesn't have some of the other funny things in it, like you have to use it right away and swirl it in a certain way than the other vaccines. So it's good. It looks like it's going to be a good vaccine. It seems to be very effective against severe disease and death, and seems to prevent transmission. So people are going to look at the numbers here, because when their efficacy is going to come out, it's going to be somewhere between 60 and 80, whereas the Moderna was 94 and 95 between the Moderna and the Pfizer. And people are saying, well, why should I get this vaccine if there's a better vaccine out there? I'm not sure it's a better vaccine. Having looked at all the studies, they're both really, really, really effective vaccines. And again, I have to use some sports analogies. So the Moderna and the Pfizer vaccine were developed at a time before there were any curveballs. And so if you've ever played baseball, your ability to hit before the pitchers learn how to throw curveballs is pretty great. But starting in high school, when kids learn to throw curveballs, your batting average plummets. Similarly, the Moderna and the Pfizer vaccine were tried out in October, November, when there were very few variants out there, and mostly in the United States, where there's not been a lot of variant disease. The J&J vaccine was tested in the UK, South Africa, Brazil, and the US. So by that time, there were a lot of variants out there. And because of that, it had a much harder to get that high level. But really, if what we're looking at is protection against severe disease, it seems to be every bit as good as the Moderna and the Pfizer. So we're very, very excited about the J&J vaccine, because it's just a single dose, much easier to give, much easier to store, and some of the funny little characteristics that are in these other things won't be there. So for example, let's say you were practice right now and you wanted to vaccinate people and you have 10 people on the list. Well, if you get 11 doses, you have to give that dose within 6 hours after opening the vial. So you have to find somebody to get the 11th dose. If somebody doesn't show up for one reason, you have to find somebody else to do it. We don't think that's going to happen with the J&J vaccine, so that's great. So Aaliyah says, have thoughts on the nicotine studies in France. I saw just a little briefing on that, but I'm going to have to read more before I talk, so I'll put that in for Tuesday. So Donna says, how long does it take to be immune after the second COVID vaccine? So the way they did these studies on the Moderna and the Pfizer vaccines is they had people in the placebo group and people in the treatment group. So the placebo group where they just got placebo, and then the treatment group where they got actually the virus, and then they had people who, when they got sick, they got tested, and then when they got 180 or so cases of disease, they broke the code and looked to see how many of those were in the placebo group and how many of those were in the treatment group. It turned out that almost all of those were in the placebo group, very few in the treatment group, and that's how they did. And so then what they did is they looked at the two groups and they did a graph of disease in the placebo group, and the disease in the placebo group is really pretty much a straight line. So they kept getting disease. For the first 10 days or so, both the placebo group and the treatment group increased at the same rate, but then after that, the treatment group really flattened out. So it looked like starting about 14 days after the first dose, you started having some protection, and that protection peaked then at 14 days after the second dose. So you already have some protection after 14 days after the first dose, and by 14 days after the second dose, you have probably as much protection as you're going to get. So that's a good thing. Now, are you going to be immune? Again, it's not 100. Nothing's 100%. Even the best of the vaccines is only 95%. So you're likely to get the immunity that you're going to get a little bit by the 14 days after the first dose, and typically by 14 days after the second dose, you get all of that. So one of the questions is, why are they sending the Walgreens COVID test to Tennessee instead of processing in Oregon? This is so confusing, because what's happening is there are tests being done in Oregon that get sent to Tennessee, and then tests that are done in Tennessee that are getting sent to Oregon. It makes no sense. I mean, if you looked at the way things are going, it makes so little sense. So some of these tests that they're doing are on what's called the aftermarket. So imagine if you're a lab and you're working with a hospital to do all of their tests. The hospital says, look, we need to have these tests done in 24 hours. And so what happens then is the lab says to the hospital, look, for X amount of money, we'll go ahead and guarantee you 24-hour turnaround time. Well, if the hospital doesn't have very many tests, you still have all those places in the rack that are basically being wasted if you don't use it. So then what happens is these labs sell secondary space to pharmacies and other people, and they sell it at a relatively low rate because it doesn't cost them much, because it costs the first part of the rack costs a lot. Those empty seats, like the empty seats on an airplane, don't cost you anything. And so what they do then is they sell those empty seats to pharmacies and other people. And so what happens then is that this lab in Tennessee may say to the hospitals there, look, for, and I'm just making up the numbers, $80 a test, we'll go ahead and do and guarantee you 24-hour turnover. And then for somebody else, and they said, well, you can take the secondary test here for $10 a test, but there's no guarantee on turnaround time. And then what happens then is the turnaround time can be longer. And what we've seen on these ones from pharmacies and other places is the turnaround time can be really long. So it's a very complex deal. But you're right, why are we sending things back east and then they send things here and things get delayed and whatever? It is just a mess, and it's because many of the labs that are doing this are for profit and they know how to make money, and so they figure out how to go ahead and make the most money by selling tests the best they can. So Stacy says, I was surprised to see the DC Home and Garden Show is occurring at the fairgrounds. Does it have good ventilation, and will it get canceled if we go to Extreme? So we talked with the people at the fairgrounds. Home and garden shows are considered to be trade shows, and there are rules for that. And I believe the Home and Garden Show will follow the rules. It will change if we go to Extreme, but I don't know if it'll get canceled. It'll change by how much the occupancy is going to be. It'll be a show, but it'll be different because there'll be restrictions on what you can do and where you can go and how many people can be there. But it apparently is going to go on. We have also talked about the Arts Festival and what are we going to do there. But again, the places that you want to do more outside is better. Bigger places with ventilation are better. If you've ever been in the things at the fairgrounds, they're pretty drafty, which is not a good thing for your heat bill, but in terms of ventilation is pretty good. So Nita says, how long does the vaccine last after both doses? The answer is we don't know. Right? There are very, very, very few people who have had 2 doses of vaccine for more than 3 months. So the 40,000 people in the study, so 20,000 people got the placebo, 20,000 people got the thing, so there are 20,000 people. And what we've seen is that at least for 3 months, they seem to have good protection. Whether that lasts 6 months, 9 months, 12 months, we do not know. We do know that with natural infection, that you've got pretty good immunity for 90 days, still pretty good for 180 days, and then it starts to fall off after 6 months. Whether the vaccine protection will last longer than that, I don't know. I don't think anybody knows. But I think they're carefully looking at the people in the treatment group to see if some of those people got the vaccine, had a lot of early protection, now start to get the disease. Oregon is doing that by doing what we call breakthrough analysis, so that if somebody gets the disease 14 days after the second dose, we're very carefully studying those people to see. So far, that number is less than expected, suggesting that the vaccine is as effective as we thought. So Lynn says, have I been asked to write a guest column? We need a response to other local providers' opinions. Look, everybody's entitled to their opinion. And I usually don't do point counterpoint things, but I think we did do a guest column last week talking about the increase in cases and what we were doing, and I think the advice that we've given all along about masking, distancing, being careful about social gatherings is still correct information. Now, there is a lot of controversy about when you open things up. Because, right, it's a balance, so that if you look at us and our doppelganger counties, they've taken a different approach to it. And some of the people in South Dakota may say we've done, in fact, their governor says we have done the best of anybody in the country. And you say, well, I don't think so. You've had like the highest case rate, the highest death rate, and yet you think you've done the best. And they say, yeah, because we haven't impinged on people's freedoms. And then Hawaii, which has had one of the lowest death rates, has really had some fairly strict rules. And they think they've done the best because they've protected a lot of lives. Their economy has suffered, but the island is still there, and people will presumably go back, and they say we've done better. And so I think it really is people's opinion as to what you think is better. Now, as a public health person, I think preventing death and illness is important, but others may think that protecting livelihoods is more important. And again, this is why we've got a great country, because people can disagree. So Elias says, is there an outbreak in Reedsport? There's an outbreak everywhere. Yes, we are seeing some cases in Reedsport. So there's really no part of the county which has been immune from this recent rise. Most of the cases in Roseburg, because most of the people are in Roseburg, but we've seen things in Sutherland, Myrtle Creek, Reedsport, all of those different areas. And again, Reedsport is an area where we're all sick and tired of this, and people want to go to bars, and people want to go to restaurants, and people want to do that, and that's indeed how it spreads. In addition, we have seen, not just in Reedsport, but in other parts of the county, people continue to go to work when they're sick. And when you go to work when you're sick, there's a real chance that you can spread it to others. So again, the information is not any different. Stay home if you're sick, avoid gatherings, socially distance, wear a mask. I mean, it hasn't changed very much since we started this back in March. So we started doing these things back the second week in March. So 11 months now we've been doing this. And I went back to look at some of the early ones. Not much has changed. I mean, we know a lot more about the disease. We know about remdesivir. We know about Decatron. We know a little bit more about how it spreads. But the idea, many of those ideas are different. Now, masking was different. So there was a lot of confusion about masking early on, about whether it helps or not. I think the data is pretty clear that it does. But other than that, we haven't changed very much. All right, a couple of other things. So one of the other things that you may have seen this week is about Neanderthals. So Neanderthals are a early species of humans that have died out, but many of us carry some Neanderthal DNA. Some of us maybe more than others. And Neanderthals had a different way to react to certain RNA viruses, and it appears that people have more Neanderthal DNA seem to be more resistant to COVID. I don't think that's anything you can change, but maybe one of those things of interest. Sort of like blood types, not anything you can change, but may make some difference in the disease. And as we learn more about this disease in the future, we may find other kinds of things that would suggest either a propensity to the disease or protection from the disease. So for example, men seem to be more prone to serious disease than women. Why is that? We don't really know, and it may be because of this weird autoantibody thing, which seems to be a little bit more common in men than women. It may be that we don't take as good care of ourselves, or that we are later in going to the doctor, but we'll figure these things out as things go on. The other thing I wanted to say again is about the idea that pre-event testing or pre-flight testing is the way to go. There is abundant evidence that a single pre-event test is really not a good idea. And so there was a group called Abundance 360. Abundance 360 was this guru guy, and they invited all of these people. They tested everybody before they got to the event, and they said, well, this is going to be sure that this is a COVID-free event, and so we don't have to wear a mask and we don't have to social distance. It can be like the good old days. Well, as they found out, somebody was brewing the disease, had a negative test, then had a positive test while they were there, and spread it to everyone who was not masked. So it really did show that pre-event testing is not a great strategy. Now, the next thing I want to talk about is the NFL. And so the NFL did pre-event testing, quarantine, and then routine, sometimes daily testing. And what they found is that does work. And so that the NFL did a pretty good job of having a season there were some issues at the NFL, but they did pre-screening and then continued screening, different from this pre-screening. They did pre-screening and quarantine, which this group didn't do. They did pre-screening, quarantine, and strict adherence to standards, wearing masks, social distancing, and whatever else. And what they found that you really needed to do all of those. So if they'd done those without testing, it probably wouldn't have worked. If they'd done those without quarantine, it wouldn't have worked. And if they'd done those things without distancing and other things, it wouldn't have worked. And in fact, the areas where they did have issues were when something broke down. So somebody went to a party that they shouldn't have, when people had a meeting in an unventilated room, where people got a ride to work or practice. That's where it seemed to spread. And so I think that reinforces that testing does have a place, but one test 3 to 5 days before you go is a mistake. But that ongoing testing could help, but it's very expensive. So the NFL basically bought a bunch of these big labs that did a tremendous amount of their work. And when I calculated the amount of money, if you bought that on the market, it's hundreds of millions of dollars worth of tests. Now, hundreds of millions of dollars for the NFL, not a lot of money, but hundreds of millions of dollars for Oregon Sports Association is not going to work. And actually, there are more high school football players in Oregon than there are pro football players in the country. And so if we were going to do the same kind of program that the NFL did, it would cost hundreds of millions of dollars in Oregon. I don't think we have hundreds of millions of dollars for high school football in Oregon. All right, so I'm getting chewed out here. If there are more questions, put them in. We'll do one last question if we got it. Otherwise, we'll do this again on Tuesday. Again, a couple of things. We do have outbreaks widespread in this area, and they're widespread in all kinds of different places. So no one person, no one group to be mad at. There's nobody to blame. If you've taken any of these outbreaks out of there, the nursing home outbreak, the school outbreaks, still it doesn't get us into the lower range. So this is something we all have to do and have to do together. And these outbreaks are getting complicated. We looked at one today. There's one person who's tied to 6 different outbreaks. And why is that? Well, they have a spouse then who's tied to another. They have kids who are tied to several schools. They work at a place that are tied to others. And so we're a tight-knit community. And so when we start to see lots of cases, we do have lots of that spread. Okay, that looks like it's the end for questions. So thank you, everybody. We'll do this again on Tuesday. Be safe and be kind. Thanks.